So now we're going to integrate our adjustment in with your fasciculation. So I'm going to be finding the area of your spine that needs to be adjusted, and then it's your job to then, stimulate that area with the contractions and the vibrations. So the thing you've got to realise is that even though you're lying still, it's not like everything's switched off. Everything's still working in there, so all of the muscles are still getting like a steady level of stimulation from the nervous system. They're still all active and they're still all kind of contracting to a degree. So if you can imagine, if your body was perfect, if there was absolutely no sort of imbalances or problems anywhere inside of there, then your body would be nice and symmetrical. All the muscles would have the same amount of tension and tightness on both sides. So what I'm doing when I'm checking your spine is I'm trying to find the areas that are mucking that up. So let's say if you have a problem somewhere, it usually leads to tension on one side of the body more on one side than it does on the other. So the way that we test that is we actually use the bottom of the feet as almost like our landmark. So let's say your body was perfectly balanced, perfectly clear. Then if I press up against your feet, almost like I'm becoming like the floor, creating the stress into your body, then the theory is that your legs will level up. Because if you stand on the ground, you don't stand on one foot, do you? You stand on 2 feet, and the reason for that is because your body's able to, balance and compensate. So if something's out of balance somewhere, then it's going to create left and right differences. So that shows up as either a left or a right, leg that doesn't balance up. So the word we use is adaptability. So a lot of it happens in here. So when you're walking, this has to move and it has to be like a shock absorber. But other things are also moving and compensating at the same time. So I'm checking your feet. So at the moment this left leg's shorter than the right leg. Okay, so now what I've got to do is I've got to work a way through your spine and try and find the area that might be causing that imbalance. So I'll just get you to turn your head one way, turn your head the other way, down the middle. So that just tests a few different points inside your neck, and then I'm going to go and test some strategic points on the spine to see if I can find the one that unlocks your body almost. So when I press on the bottom of your sacrum, your legs now are able to level up. So what that tells me is that this is kind of the point that's going to unlock your body the best. So I can test other points, and the principle of this technique is that there's only going to be one point in the body that's going to balance things up. So once I find one, I don't have to go looking for 50 others, because I know that that's the only one that's going to be there. So now we're going to adjust that area, and we use our integrator. And the reason we use the integrator is because it's a really nice little impulse of energy in through your nervous system. You could do any other kind of adjustment as well, like the old-fashioned style, or lots of different ways of adjusting, but I prefer to use the integrator. So I'm going to adjust your sacrum, and then your job is to then do our knees in, heels up, hips up, to try and create that fasciculation into that same area. So we're sort of working together to really, tune and balance that one area. There you go, so you can push in, lift, lift. So just as long as you feel like you're comfortable. Good job. So then we check again to see, you know, how you're going, whether we've leveled things up anymore or whether you're still out of balance. But the principle is once you've adjusted one area, unless you're perfect, there's probably going to be another spot, you know, so it's almost like layers. So now we're looking for the next layer that's, you know, causing your body to be out of balance. So we'll get you to turn your head again, and the other way, and down the middle. Alright, so now we've got your C2, which is like the second of the 7 vertebrae in your neck. So I'm just going to test to see which direction it likes the most. So when we adjust your C2, so it's obviously in your neck, so we're going to be lifting, slightly tucking, and I'll give you some other direct specific instructions as well for that spot. So lift, tuck, and then try and slightly kind of push the side of your head into the face slot there, so you're almost like straining against the table a little bit. Just till you've had enough. Good job. Just climbing up the table there. Okay, so we're turning our head again, another way, down the middle. Okay, so now your C7 is the next layer. So the bottom of your neck. So just going to adjust there. So now we're going to push in, try to lift up in that area there. Excellent. Good job. So we usually only do a maximum of 3 layers in one session, just because, you know, less is more sometimes. You might say, keep going till you've got rid of every layer that's ever been there, you know, but there's, what, 32 years of layers there. So we might be here for a little while. So 3 layers is a good, you know, good clean out for your nervous system.